Wonderful. Thank you. So good afternoon, everyone. Thank you so much. My name is Gillian Henker. I'm a co-founder of Sisu Global Health. Today, I'm going to be talking about user-centered design and implementation of a medical device. Just as stated before with this group, my background is in engineering and design. So I will be talking about clinical challenges here. Just to start off, the need that I'm going to be talking about today that is connected to the device is the global blood shortage. So in a lot of places around the world, the need for blood is dire. So they could have up to 50% of the blood that is required is not available. So whenever a clinician goes to reach for a unit of blood, it's not there. So that's where, in order to increase the blood supply, there is a technique that some of you might be familiar with called autotransfusion. So autotransfusion is a way to give blood back to the same patient through different methods. And the one that we put together at Sisu Global Health is called Hemafuse. And so it's bringing autotransfusion to a global reach. We work mainly in emerging markets. So this device is one that allows clinicians intraoperatively. So this can be a surgeon, it can be nurses, anyone who is, scrubbed in can use this giant syringe-like device to suction blood from an internal hemorrhage and filter out clots and particulates, and then push it into a blood bag that then can be retransfused to that patient immediately. So I want to go through basically the journey to create this device that we went through as the chief technology officer and the person who was an inventor on the product. Again, this has been indicated for anything from orthopedic surgeries, general surgery, as well as a couple select OBGYN surgeries. So to go through this journey, again, so I'm an engineer. This was a group of engineers and global health students back in the day. We traveled to West Africa and Ghana and spent 6 weeks working with different departments within the maternal health sphere. So we were specifically looking at Millennium Development Goals in maternal health and infant health. And while I was there, I was asked what my blood type was. And I said, why do you need to know my blood type? And it's because they were looking for donors to donate because women were hemorrhaging and needed the blood. So that's where we discovered there's not enough blood. What are they doing? They're looking for donors. They're looking for autotransfusion methods that are a little bit older and not as common in most practice nowadays. So let's look at other ways that we can develop an autotransfusion device. So that's where it kind of launched us into the human-centered design concept. Again, we're working with patients who are in surgery. And so we do work a lot with the surgeons, the scrub nurses, the anesthesia staff to develop this technology, to look at usability, to look at where would this fit into clinical practice, who would be touching this and using this. So we did a lot of 3D printing prototypes, a lot of water demonstrations, a lot of abdominal simulations to say, hey, what is the scenario? What works for this group of clinicians? Because in a lot of the places that we work in sub-Saharan Africa, you might not have, it just might be a medical officer. It might just be an anesthesia tech. So there's a lot of task shifting and understanding who can operate this device and how can it fit into their practice. And then again, as an engineer, love the development side. So it was interesting to hear from the digital side. As a physical device, 3D printing was really an amazing tool for us as we went through and iterated on different models of the device before going into kind of the design freeze that was described earlier on having to put things into metal and to really make what is closest to your final device. So here we have in the middle the 3D printed model that we then put into a mold, and then had to start making our filters in a clean room even before looking at the testing side. The picture down here with the bucket there's a rubber band on the device, and that was our first proof of concept testing that we did at the blood bank at the University of Michigan to see the quality of the red blood cells. So all of this then going into our product testing. So here we're doing some pressure testing with sensors. We're doing pig's blood testing to look again at hemolysis and quality of the blood. And then under the hood, there we're actually doing our comparison testing to a US predicate device. So here again, we went back and talked to users iteratively as we made changes to the device. But also, we have to meet certain standards as a medical device to make sure that we can get through regulatory. But in doing then the bench testing, we went into a clinical pilot. We did 12 patients in Ethiopia where we just suctioned the blood and then went to the blood bank and then had it tested to make sure, even though our device wasn't affecting the blood adversely, it was making sure that the blood from that surgery. So this was used in ruptured ectopic pregnancies on that. And this is where we also really honed in on our model for the device. I know it was described like, what is the procurement? How do you package this? So our device is actually, the pump is reusable. So one of the major findings we had in talking to clinicians is you have this giant syringe, and we're talking a half-liter syringe here, that, in the US or some other markets might just be completely disposable. It's just tossed after one use. But we found that tubing or other items were constantly reused because of the value they had and the need. So that's where the pump is actually reusable up to a certain amount of times, with then the disposable parts being as limited as possible, noting that it includes probably what a lot of clinicians here are familiar with, a Yankauer tip and tubing and a stopcock, in addition to our filter, which is 170 microns, and having to describe the fact that that cannot be reused. These items have to be disposed of. Was something that we really learned in the pilot and some of these other usability trials on understanding what that system is, not only with the clinicians in the surgical suite, right, but also with the CSSD staff or the central sterilization and sanitation departments, and really understanding the full ecosystem of where this device goes in the hospital setting. And then we get to the fun part here where regulatory. I can go into this more, but just to say that we have ISO 1345 as a company. So that's something we're really intent on. It's a quality management system, well recognized. And then we do have regulatory clearance for this device. We started in Ghana with their local regulatory service. We actually had to send samples of the device over there. And even for a renewal, we had to send samples. We're registered with Kenya for their Pharmacy and Poisons Board. And as of last year, we just got clearance in the US for a single use only version of this device, which fits better with the market in the US, again, where they're looking for that sort of product. And just to say here, it is a class 2 device. It does qualify under the pre-market notification, if folks are familiar with the 510K process. And these are similar devices that again, some of you might have used the Cell Saver device and the Autolog device in particular. So once we get clearance, this is when we really wanted to work on training users. So to go into the implementation side, training is so important. And I just wanted to show here that we do use a very, I don't want to say rudimentary, but a very simple simulator, right? So looking at these abdominal simulators and different versions of them to have clinicians really try out the device and learn how to work not only as an individual, but as a team for collecting the blood and transfusing it and positioning themselves. So these are just a few pictures on training teams and really getting that time with them to practice, especially a physical device like this. Yes, and then we've had uses in the field. So here we have a couple of Hemafuse units. They're already being transfused in surgery, and then a couple of clinicians who, these are on the right, these were the two clinicians scrubbed in and then one anesthesia tech. And this is the one on the right is a very rural hospital in northern Kenya. So that was really, again, we see this as providing blood where blood is needed for the surgeries that, that it is indicated for. So then we went into market launch. So just to say here, once you do your training and you get those initial uses, there are a lot of promotions and working to get the idea out there. So here on the top left, we have the First Lady of Kenya, who at an event with an NGO partner of ours, again with the abdominal simulator and one of our staff showing off the device. This is us giving over, again, a introductory unit to the cath, actually the hospital at the very beginning that I was at many years ago. And then again, working with different hospital CEOs and administration. And then on the bottom left here, you can see even at conferences and talking to clinicians, again, constantly getting feedback and understanding of where they see the use of this device and how they can build it into their practice. So just to say, we a bit on scaling, we started in Kenya as kind of our starter for a variety of reasons that I can go into based on questions, but we are looking to scale more geographically with this device. So we're in Ghana as well, and we're looking at other African nations. And then we are looking to grow more regionally, looking eventually at India, Southeast Asia, and other parts of Africa, as well as, we are looking at other modifications that this device can go into for different markets as like a purely single-use device that we can work on maybe for more emergency situations, possibly outside of surgery, and other future design to grow. So, and this is kind of our journey. I'm completely open to questions. And again, my background's in engineering, so I can talk more on the design and product development of physical devices. Thank you.